Good morning, Miss Dombecker. How are you doing?
Good, how are you?
I'm good. My name is Remy. I'm going to be your nurse today. I'm going to be administering your Furosemide this morning, also known as Lasix. Are you familiar with this medication?
Yes.
Okay. So I'm just going to be educating you on this medication, asking you a few questions. Is that okay?
Yes.
Perfect. So Furosemide is a loop diuretic. We use loop diuretics to help decrease your high blood pressure, edema, and to excrete excess fluid that you have retained in your body. Because of your heart failure, your heart has a difficult time pumping blood, which is why your legs are swollen. So this loop diuretic will help reduce that by draining the excess fluid in your body. When you have a lot of excess fluid in your body, it can cause difficulty breathing, so it is important that we monitor your edema and give you the Furosemide. So your labs came back safe for us to give your medication. Your potassium was a 4, your creatinine was a 0.9, and BUN was a 10. You present no signs of dehydration. Your I&Os are normal. I just checked your blood pressure and it was 126/86, so this medication is safe for me to administer. Can I get your name and date of birth?
Maddie Dombacher, 5504.
Perfect. I'm just going to check your ID bands. I have the 40 milligram of Furosemide. I'm going to check the MAR 3 times to ensure this is dry medication, proper dose, route, time, and administration. You're going to take this pill by mouth every morning with water, and you could take it with or without food. Okay?
Okay.
Before I give this to you, I'm just going to go over some adverse effects you might experience while taking this medication. So you could experience hypotension, which is low blood pressure. It's important to check your blood pressure every morning before you take this medication. This can also cause orthostatic hypotension, so make sure you are changing positions slowly and dangling your feet off the bed before you stand up. Okay? The next is hypokalemia. This is low potassium, which can seriously affect your heart, which is why we monitor your potassium frequently and encourage you to eat foods high in potassium like bananas, potatoes, avocados, spinach. It is also important to monitor the signs and symptoms of hypokalemia, such as fatigue and very irregular heartbeats. The last one is ototoxicity. This is if you experience any hearing loss or any ringing in your ears. It is important to notify your provider if you experience any of these symptoms because we may need to adjust your dose. Okay? Now you can take your medication. Perfect. So we're going to keep monitoring the swelling in your extremities and taking daily weights. When both these decrease, we will know this medication is effective. Do you have any questions?
Nope.
Perfect.